take it away.
Sure. If you want to share, if anyone wants to share my information, feel free. So my name is Julie Richer, and professionally, I basically represent and try to get the word out about our PACE program. So, and I'll kind of explain what PACE is. Um, and it's a nonprofit organization that I work for. And I started actually on the community health center side. So I was originally brought on board to do the marketing for one of our new sites. So I'm sure you're familiar with what a community health center is, or we'll explain it a little bit in the presentation too. But so I've worked in different types of healthcare, but this is the first time working specifically with older adults. So that's been nice, and it's sort of, as I think happens to a lot of us as you get into like your 50s and early 60s, it kind of dovetailed with personally me actually caring for both of my parents, um, and it's very interesting. It's one thing like you do it professionally and you're giving advice to people and you know how the system works, but then when you're actually the person who is in that caregiving role and try to navigate the healthcare system and obtain services, you realize it's really quite a challenge. What you do is great because there are options for people, although it still doesn't make it easy for people who have more means. But for people who are lower income, or I would imagine you probably also work with folks who don't have significant family support or friend support. So people that are a little bit more alone in their journeys, and your care and your advice and your guidance, I'm sure is so crucial to them having successful outcomes. So that's great. Donna, I feel like, are you from Massachusetts? Your name looks very familiar.
We probably met briefly at that conference, that recent
Okay.
conference. Yep.
Okay, that might be where it was. Yeah.
Mhm.
So anyway, so now, as I said, we usually use Teams. So I'm going to attempt to share. I think I just will share my screen and yeah, and then hopefully we can get this to share correctly. Okay.
Wonderful.
All right, let me just put it in slideshow mode. Okay, that went a little smoother than I thought it would. You know, when you're using a new system, it just kind of makes you feel foolish. Like you're like, I know it's here somewhere, I just can't seem to find it. So anyway, can everyone see the screen? Okay, great.
I'm not sure
Um,
you're in slideshare mode though. Are you in
uh,
screen?
um, I thought so. It looks like I am for me.
Perfect.
I think it
Does
is
it?
from here. I think it is.
Okay, all right,
Yeah,
great.
same as, yeah.
Okay, and I'll send these along to really, I kind of have the slides honestly to make sure that I cover everything. Um, oops, maybe I'm not because it's not moving forward. Okay, let me stop sharing for a second and we will give this another go. Um, hmm, okay, let me try this. Share options. Okay. Try this and just try sharing. Okay. And it's not, hmm, I'm having trouble. Resume slideshow. All right, let's see if we can okay, good. Now it's moving forward. This is the part where you feel foolish. So anyway, so just to explain a little bit about Harbor Health Services. So we're actually a nonprofit agency ourselves. We are originally a community health center organization. We actually have the oldest community health center in the United States, the Geiger Gibson Community Health Center, in what used to be called the Columbia Point is now called Harbor Point section of Boston. And essentially, those two physicians came back from working abroad and found the same lack of access and care that they were finding abroad in the United States. This was in the mid 60s. And so they decided to develop a care model that was called the Community Health Center. And they started that movement. So across the United States, there is hundreds of thousands of community health centers. that serve a significant population within the United States, both of people who tend to be a little bit lower income, but also sometimes it's access in rural areas. They'll set up in areas where it's not economic for a physician to run an office. And they also, I'm not sure about in other states, but in Massachusetts, they care for everyone. So even if you don't have health insurance, before Massachusetts mandated health insurance, this was a place you could go. And even now, newcomers to the country won't have health insurance, but they can get basic care at a community health center. We serve about 30,000 patients. And the other part of our organization is the PACE program. So Harbor Health Services is really a medical social service agency, and we're serving all ages at the community health center. But then about 35 years ago, the state came to community health centers and asked if they would be interested in offering this new program called PACE, or Program of All-Inclusive Care for the Elderly. It had existed in California for about 20 years before that, before it became a program of Medicare. So it's similar to hospice, and that like hospice is a program of Medicare, and we are actually a program of Medicare and Medicaid. So we took that on, and we have a couple of awards here. The top two are our community health center awards, but one of the ones that we're very proud of is we're designated as an age-friendly health system by the Institute for Healthcare Improvement. And it's really integral to the way that we work with patients to provide them care. And we'll talk a little bit about, you're probably familiar with that, but just in case you're not. So this is kind of the what makes the PACE program different. So PACE is really a different model of care. So when you have people who are younger or healthier seeking care, they're doing so in a system that's a little more fractured. So all of their care providers are separate. They're not working on the same electronic medical system. They're not really communicating with one another, and that might be fine. But when people get to the point that they are eligible for the PACE program, meaning that they're at risk for having to go to a nursing home, they can no longer live independently without support at home, this model of care better serves their needs. So the care is fully integrated. So this PACE interdisciplinary team with all of these various clinicians meets every day to discuss the care needs of the patients in their care. And they only care for, it's about 150 to 200 patients. And that's because their care needs are so significant that they really require that kind of like hands-on day-to-day dedication from the team. So we've got the 11 clinicians working together. They get to know the person really, really well. This also helps to take the pressure off of family members who often, that care coordination piece often transitions to family members as someone ages and their care becomes more complex. We also offer at our medical center an adult day health center, which was key right from the beginning of PACE. And one of the things that makes PACE different is that an individual can come to the day center for the day. They can be supervised, they get their meals, they can have their hygiene. We have washers and dryers, we do clothes washing for people. They can have their medication, they can have all of their health needs, immunizations, occupational, physical therapy, social work, all those appointments done while they're at the day center, and then be transported home in our vans at night. Often have an aide at night for an hour or so to help them get ready for bed, and then stay at home because they've been supervised all day long and they've had the socialization. So it addresses, socialization needs, medical needs, supervisory needs, the needs of the caregiver. So it's really integral to the program, these two pieces, the day center and the interdisciplinary team. Another thing that happens that's important with PACE is that the services are very adaptive. So when people join PACE, often they don't need all of these services. But if you've been with us for 3 or 4 years, and as you age in place, often you're going to need many of them. And so they become layered into your care plan as your needs progress so that you're not searching for a new solution every time your care needs progress, which is often what happens. Also, just even transitioning between care settings. So if someone's in the hospital and then they have to come home, there's a team that's going to supervise that return home. So these are real differences in how the care is developed and is provided to somebody that makes it possible for these very frail individuals to stay at home. Um, this is a little bit different. I just include this slide and we can talk about it if you want in more detail, but what makes PACE a little different too is that we are both the provider of the care and we're the payer of the care. So because we are a part of Medicare and Medicaid, most people who join the program do so without any monthly cost. So they receive all of these benefits. We'll go over in the next or two slides over without a cost. And so that access issue, which is often cost driven, is addressed through the program. It also gives our teams really great flexibility because they can decide the care that their patients need instead of an outside insurance company making that decision for them. And I'm sure you've all dealt with insurance companies, so you understand what we mean by that. This is just a little patient demographics, and I'll send you the slide too that you can see. But you expect more female. Average age is 79, although you can be as young as 55 and join the program. But what always strikes me with this is just the average number of diagnoses and medicines that people have on the program. So they're very complex. This is a list of all the services that are provided. But the easiest way to think about it, if you're familiar with Medicare and Medicaid, is when someone enrolls in the program, they have first dollar coverage with no waiting periods and no limitations for all of their Medicare and Medicaid benefits combined. And this is really important for some of those ancillary services. We have people that come to us that have 15-year-old dentures or, walkers that are held together with duct tape because they weren't able to access those ancillary services that are often not covered by insurance. So that's where I think one of the PACE program can be really helpful for people too, is that lack of access can come from a number of different areas, but cost is certainly significant for a lot of people. This is just to give you an overview. PACE programs always have a service area. So in Massachusetts, we have 8 PACE programs. And across the country, I believe it's 42 states that offer PACE. So for people in other states, because I know you're not all from Massachusetts, if you want to write this down, the National PACE Association, NPA, is a website. And on that website, they have Find a PACE Program search engine. You can put in any zip code and it will pull up all of the PACE programs that serve that area. So if you're working with clients in a different area or you're not from this area, that's a great resource. There's also all kinds of information about PACE on there, but that's a really useful function. To be eligible, you have to be age 55 plus. Between age 55 and 65, you do have to be disabled. But over age 65, you do not have to be disabled. But in either case, you need to be essentially frail. So you need to be deficient in a couple activities of daily living, or have a skilled need with that, and just basically require assistance to be successful living at home and managing your own care. Be living in or moving to the service area, and then in Massachusetts, your income has to be below $2,900 a month and your assets below $2,000 per individual. So if it's a couple, then they have a different amount of money they can have per person. But both of those measurements are per person. It's difficult if your income is above our level. There really isn't too many things you can do about that. However, if your assets, there are ways to make people eligible for Medicaid, like they can spend money on bills, they can use prepaid like burial accounts, they can move funds to trusted family members to pay for their care, things like that. So there is some flexibility, and that will vary from state to state, that income level, because it's 300% of the federal poverty level. So it depends, based on your area. Um, it takes about 45 days to enroll. Unfortunately, we're not like a direct from the hospital um, enrollment process. And it's like Medicare, so you end up being enrolled on the first day of the month after you are approved for the program. And that's it. Um, I'm assuming there probably is a few questions. Let me stop sharing, and I'll plan to send that out to everyone afterwards. Um, any questions about the program?
So Julie, I have a question.
Have a couple.
Sure.
Does it cater to the homeless? I mean, does someone have to have a home in order, because it just occurred to me, I didn't see that many people there at your day program. If it catered to the homeless, it would be packed. So maybe you don't.
No, so it's interesting. One of the things I was just looking at was sort of like the last 6 months of like where our referrals came from. And we work pretty extensively with Father Bills and Wellspring, which is an organization. I was at an event at Rosie's Place. So we do work with people. It's difficult if they're really truthfully living, like you'll sometimes talk to people and they'll be like, well, I live in Trinity Square. If a person is really living on the streets, it is a little difficult for us because it's hard for us to find them. However, what a lot of people who are unhomed, what they're doing is they are in temporary, like single room occupancy homes through like Father Bill's has about 700 of those units, or even living permanently or close to permanently in a shelter with a case manager. So in those cases, those people can enroll in PACE. And we do have people, we have actually quite a few. I think there was about 8 people from Father Bill's that enrolled in the last 6 months with the program. Sometimes what happens with those folks is they have other day programs that they have been attending for a while and they don't want to make that change, which that's the flexibility of the program too, is that there may be a time given like healthcare issues that they might be more appropriate. They may not be able to continue where they are because their care needs are too high, but for right now they can attend their current arrangement.
Cool. Donna, I see that you have a question.
I'm sorry.
Yeah, Julie, thank you so much. I love the PACE program.
Oh,
Love, love,
thanks.
love it. And I've gone to a couple places that have it. I was going to ask you, I've been to Methuen, I believe, where
Yeah.
they have like a center where you can live.
In housing, yeah.
Yeah. So how many of those are there?
Sure. So that is a growing trend to put PACE like in housing. So we, like in our particular case, we don't have full centers in any housing. However, what we do have is like we have two congregate homes. So we worked with the Public Housing Authority to essentially take these congregate homes, which are single room occupancy rooms with shared common space, and turn them into PACE homes. So everyone in that home is on PACE. So then the service providers are coming to them, and then when they come to the center, a van comes and picks them up and brings them into the center. We also have some other housing arrangements where we have PACE set aside rooms so that our members have access to affordable housing. So that's really a key part of the program. But there are a couple other programs that have been able to build small or sometimes even larger centers right in. I think you're talking about the YMCA up in Methuen. Is it Element Care?
Yeah, all I know is that I toured it. It
Yeah.
wasn't a YMCA at that point, that as far as I
Okay.
know.
So I think it might be in conjunction with the YMCA,
I
but
see.
it's yes, so that is a model. Now, one thing I will say is that we are a nonprofit organization, so building these centers is they're expensive to
Sure.
build. So what we've been doing is instead getting these arrangements where we have set aside rooms in housing. And then that way we're addressing the housing needs of our members and then using a center nearby. So that, but it is true that the goal is like we're exploring right now. Actually, I just sent an email before this, putting our resident service coordinators, so kind of like a not a patient navigator, but like a social service navigator in housing in Brockton. And we also work extensively with veterans organizations in their housing as well. But
And
yeah,
is there,
there's
because I really love the idea that you have all of these providers, because so much of my time is spent finding individual
yeah,
providers for my clients. And it's hard.
yeah.
It's really hard. And I love that they're all together. Um, is there uh, somewhere a list of all the different PACE
Mhm.
homes, or would that be?
So in terms of like pace, so I would say this, they're really well, there is a pace. I haven't seen it for a while. I know that the state worked pretty closely with a couple of PACE programs. We all contributed to this PACE housing guide. It
Ah,
was a guide that was kind of designed for people in housing to introduce them to PACE, but
uh-huh.
they would give different examples because what happens with the PACE programs is we kind of work like in our geographic area. There wasn't a big new building going in, but there was congregate home when Colleen Doherty, who runs the Taunton and a bunch of different housing authorities, came to me and we were talking. She's like, I have these congregate homes. They're kind of difficult. They just are not working the way congregate homes are supposed to work. What about this idea? So like we try in our respective service areas to meet like our needs of the community. So there isn't like one listing. Um, there is in Mass Pace a listing of all of the all of the programs in Massachusetts. That's another website called
Okay.
masspace.net. Um, but the other thing, like we are working with Fenno House over in Quincy. They are nonprofit assisted living and they have Section 8 vouchers so that people could get like an assisted living level of care. So that's something we're looking on. We're excited to build out a deeper collaboration there.
Thank you. That's very helpful.
Yeah.
Fabulous. Tanya, did you have a question? You had your hand raised.
I do. I have a couple. It
Sure.
sounds like your work is so extensive. Where does most of your funding come from? Or is that everywhere? And it just
Yeah.
seems like it must be quite expensive.
It is expensive. Yes, turns out caring for older people with significant health issues who often have not had the care that they should because they have are more moderate income is very expensive. So we're funded through Medicare and Medicaid. So when a person joins us, I don't know if you're familiar with this, but there's a couple different ways healthcare is paid for. One is fee for service, which means every time you go to the doctor, generates a bill and your insurance pays that. Another way is what we are, which is a global or capitated payment. And what happens is that the two, Medicare and Medicaid, most people are dual eligible. Some are Medicaid only and some are Medicare only. But those two agencies pay us a certain amount of money per person to provide for all of their care. So it pays for all of their care at PACE. And then, like, say somebody goes to the hospital or somebody needs some imaging done, we actually pay those bills with the funds. So, what we have to be sure of, like, we have to layer in a lot of preventative care to make sure that we avoid those more community health center side has always done a lot of work with grant funding. And we have some projects that, I was saying to my boss that we need to dip into the grants because the original budget, we need to have like a pot of new initiatives. So that's the other source. And like I said, we have experience on the community health side doing that. Yeah.
And then I had one other question.
Sure.
Actually, I have lots, but I'll just limit it to two.
Mhm.
But I noticed in the breakdown of patients that it's very heavily English speaking.
Mhm.
Is that because the word just is harder to get out in? Because I would think, and we live
Yeah.
in a highly Hispanic area, so most of our community centers
Yeah.
it would be 50-50 at least.
Yeah. I'm not sure. So that's across all 8 Mass PACE programs in Massachusetts. So there are areas that are like out near past Worcester that are fairly rural. I know we certainly have we have the largest concentration of Cape Verdeans in the United States in the Brockton area. And we have a lot of people from Brazil who speak Portuguese down in the Plymouth area. We have a lot of Haitian folks up in Mattapan. So we do enroll those folks, but then in our particular situation, we then also have a lot of areas, like suburban areas, that the languages are a little bit more predominantly English. And I will say too, that in our like Quincy, which has a very large percentage of Asian folks, we have at times, like I would say, it's like we need to find a way to better connect with that community, and it's challenging because we need to have the providers on board, the staff on board. It goes beyond just like translating documents. It really comes to like totally integrating ourselves and probably building relationships with those providers that speak Mandarin or Cantonese or Vietnamese, so that then they become a part of our program in an ancillary way. So that is something we've been working on. We've grown in that area, but we're not where we would like to be. Yeah.
Julie, I'm going to stop there. I know
Yeah, I'm sorry. I took a lot of your time.
I know
Sorry.
all the others have questions too. This is so incredibly interesting. And I have your contact information.
Yeah.
We'll share the slides. It's good the other MACA members couldn't come because
Yeah, because it could be long. Yeah.
dominated. And we're so grateful that you
Oh,
took.
thank you for having me.
Thank you.